everyone, this is Frenesi and welcome back to my channel. Here with us today is a licensed physician sharing evidence-based health info and advice online for free. Nice to meet you, Doc Kilimanguru.
Hello, thank you so much for having me. Excited to talk about our topic for today.
Yes, thank you for allowing us to interview and
Of course,
share
fellow
everything.
mental health advocate.
Yes. Doc, ano yung pinagkakaabalahan mo ngayon?
Well, right now, I'm really focused on building my brand on social media. So I'm known as Dr. Kilimanguru. So fun fact, that's not my real name. It comes from my name, Kilimanjaro. And then yung Jaro, pinalitan ko ng Guru. So that when they hear my name, Kilimanguru, alam na nila what type of content to expect, which is the educational type of content. So yun, Kilimanguru. And really, I want to break all the misconceptions about health and make sure na yung nakakarating na information to all of our fellow Filipinos are factual, evidence-based, science-based, and who better to talk about that kind of information than a doctor. Kaya I'm joining Doc Willie Ong in his advocacy for public health education. And for me, I've added also mental health to my videos because it is something na more and more people are becoming aware of. Pero I think kulang pa ng understanding. So more than the awareness, I think they need to have like an in-depth discussion kasi alam nila na may depression, alam nila na may anxiety, but what really are these mental health illnesses, diba? And that's what I want to give the audience sa mga videos ko, to give them like some sort of a formal education but in layman's terms.
Yes, perfect. Kasi yun yung nakikita ng mga tao and yun yung hinahanap ko rin. Nung nakita ko yung mga videos mo, ito yung perfect na, alam mo yun, na gusto kong makausap para ma-educate palalo yung mga Pilipino. Kasi sa Google kasi, di ba, iba-iba yung ma-research, di ba? Pero from someone na licensed, professional talaga, manggagaling yung mga facts, mas papaniwalaan, mas eto na to, real na to, andito na siya. And I really admire you for that kasi I really want to stop the stigma about mental health. Yun. And gusto kong malaman saan nagsimula si Dr. Kilimanguru.
Well, Dr. Kilimanguru started really on YouTube. Tapos yung content ko nun wasn't really educational. Punong-puno pa siya ng mga skits, random thoughts lang na I share with other people online. Very magulo pa yung process ko nun and mahina yung engagement. And for those who don't know kasi, my pre-medical course is actually Bachelor of Arts in Communications. So doon nagsistem yung passion ko for creating videos, for speaking and educating others. And with my degree in medicine, I wanted a way to kind of marry the two degrees together. So communications and medicine, what can I do with the two? So ayun, with the skills na natutunan ko from mass comm in creating videos, writing a script, editing videos, ay na-apply ko yun in the content I make now. And syempre, my degree in medicine is what backs up the qualifications, I guess, for me to talk about health information. And so from YouTube, hindi talaga nag-work yung skits. I decided to move to Facebook. And doon, gumagawa pa ako ng mga jingles about health. So meron yung isang video na ginawa ko. That was one of my first health videos na nag-viral. That was about kung paano mag-deliver ang mothers in the hospital. Kaya gumawa pa ako ng kanta about it, like, hinga kang malalim, pigil and push, yung ganun. And I received a lot of positive feedback, especially from the first-time mothers na parang medyo takot sa normal delivery kasi masakit, ganun. And some of their OBs even thanked me kasi parang pagdating na nung patient nila sa delivery room, alam na nila yung gagawin nila because of that video. And from that response, mas na-encourage pa ako to create more videos. Hindi ko na na-maintain yung paggawa ng jingles. So, I applied skits or yung simple talk-to-cam na format na lang yung ginawa ko. And in order to catch the attention of the audience, no, kasi I'm one of the people, pag sa classroom, pag science ang pinag-uusapan, admittedly, isa ako sa mga inaantok. Yeah, it's really ironic, no, doctor, pero inaantok sa science. Ano yun? Kasi very monotonous kasi yung delivery ng information. And health is something na dapat alam ng iba, hindi lang yung mga healthcare workers. I mean, medtechs, nurses, doctors, respiratory therapists lang ba dapat ang may basic knowledge about health? I think it's something na everyone should have access to. So, ayun, pag dinideliver ko yung information, I thought of a way to kind of break the ice or add some spice to the video. Kaya naisip ko yung char. So yung char, it's something na randomly sinasabi ko in a conversation with my friends, with my family. And sabi ko, oh, maybe this is a good way to bring more life into my videos by adding the char in between educating others para ma-attract sila, di ba? To gain their attention, to make sure that they watch the video. Even though it is about health, at the same time, my entertainment factor din when I talk about the when I talk about the topic.
Oh yes, kaya naman pala hindi nakakapagtaka na parang ang kausap ko ay nasa CNN.
Wow.
Well, meron siyang bedroom voice.
With Santiago reporting.
Char.
Char.
Yes, latest issue. Actually, ginawa na niya to sa Facebook. Gumawa na siya ng video about the disorder, mental health disorder of Amber Heard.
Mm-hmm.
Yes. Can you share with us kung ano naman ang usual na nagiging problem ng mga kalalakihan about mental health? Please educate us and make them feel na it's normal.
I see. Well, for starters, no, mental health doesn't really choose who it affects, no? It doesn't matter if you're a woman or a man, young, old, rich, or poor. Mental health affects everyone regardless of who you are. So mental health really stems from our experiences, you know, starting from childhood. If you grow up in a place where it's toxic, you experience a lot of trauma, you yourself experience abuse, or you witness abuse. So all of those things factor in sa magiging future natin in terms of our mental health. So that's one of the things na we have to look at. So babae lang ba yung nakakaranas ng traumatic experience? Of course not, pati rin naman lalaki. And depression. So depression and anxiety are the two most common mental health disorders that everybody knows about. And both men and women experience this. Yun nga lang, 1.5 to 3 times more affected lang ang women when it comes to depression. Siguro yung pagkakaiba lang sa men would be the symptoms. So for example, when it comes to the emotional symptoms, no, for a depressed man, they usually present irritable, angry, pero pagdating sa babae, they're more quiet, reserved, and they cry. So it's more of like a soft yung presentation ng depression sa babae, whereas sa lalaki, it's more intense. So depression can present differently when it comes to the gender, but you shouldn't assume na parang depression is para sa babae lang. Because men definitely can still experience depression. And I think one of the reasons din kasi why we need to open the conversation about men and their mental health is because in our community, particularly the Philippines, we live in a patriarchal community. And although not true naman for all family setups, I know na sometimes the mother is the breadwinner, it's not always the father. Pero kasi we can't deny that double standards still exist up to today. And for men kasi they're expected to look brave, and they're not supposed to show signs of weakness. So kaya yung mga ibang lalaki, they don't want to talk about their feelings kasi number one, they don't want to be seen as someone inferior in the community. Kasi nga dapat sila yung provider, di ba? That's the label that the man gets, the provider. Well, of course, women can provide, pero yun nga, yung pressure, I guess, sa men mas malaki. So they choose not to because they feel embarrassed to talk about it. Kasi parang yung comment ng iba na sumusunod sa societal standards is, kalalaki mong tao, ganyan ka. Kalalaki mong tao, umiiyak ka. Kalalaki mong tao, nagdadrama ka dyan. Kaya, kahit na gusto nilang mag-open up, they suppress it na lang. And kung na-encourage mo naman na mag-open up siya, he is judged by others. So what can we do, diba? So number one is really making others realize na emotions are normal, no matter what emotions you feel, sadness, happiness, anger, irritability, exactly. It is valid regardless of whether or not you're a man or a woman. Now, for men in particular naman, yung isa pang condition that they are more prone to would be the substance use disorder. So for men kasi, when they experience depression, they have more of a risk-taking behavior compared to women. So for women, the way they adapt to depression is they cry or they choose not to eat. Parang may loss of appetite when it comes to women. Whereas when it comes to men, their way of coping up with the depression is through substance abuse like alcohol, drugs. So when you see a man is binge drinking, tapos parang chronic na siyang nagbe-binge drinking, it's not because lasinggero siya. It's probably stemming from a mental health disorder. He's probably depressed. I mean, just because he's not crying, like how you think depression looks like. Kasi akala nila may certain itsura ang depression. Yan. So they think you're like quiet lang, to the corner, not talking to anyone. But depression can also present as that, yung binge drinking. And that's because yun yung, kumbaga, comforter nila. Because men don't open up about their feelings, di ba? They have no one they choose not to share it. They feel na walang gustong makinig sa kanila. And so they turn to alcohol as their comforter. So there. And we can prevent that. We can prevent men relying on substances to comfort them if we just allow them to speak. Pero easier said than done because not everyone in our circle would be willing to listen to our problems. So another thing why men don't really like to open up about their problems is number one, yun nga, embarrassed, and they don't want to feel like they are a burden to others. So feel nila na parang pabigat sila. Ano ba naman to? Ako dapat yung nagbibigay ng hope sa family, pero ako naman na yung nagmumukhang pabigat. Sige, wag na, sarilihin ko na lang. I'll deal with it on my own. And yung pangit dun kasi, if you choose to not address the problem, parang sige, sarili ko na lang. I won't tell anyone and I'll just move on with my day. Ang mangyayari kasi dun is, your body will find a way to express your feelings like throughout the day. So for example, you're feeling angry about something, you have an argument with someone. For example, siguro ako, I have an argument with my partner, pero I choose not to address the problem. So I just, sige, nag-aaway kami, whatever, I'll just brush it off and tomorrow will be okay. That's not gonna happen. Kasi along the way, it will make its way out of your system. For example, nagdadrive ako, and then may sumingit sa harap ko. Bigla akong, ano ba yan? Bigla akong magagalit. Diba? Saan nang galing yun? Bakit ang grabe naman yung galit ko dun sa sumingid sa akin? Diba? Parang sobrang road rage ka naman. And that's because there's a feeling, an emotion that I decided to keep and not address directly with my partner. So, in the end, na lumabas siya sa ibang situation, na sana nilabas ko na lang dun sa actual problem, because I didn't do that, lumabas na lang siya sa ibang situation. So that's why it's important to really talk about, kasi pag nagpipigil ka ng emotions, it's the same as pag nagpipigil ka ng pag-poops, sorry, pagpipigil ng ihi, masakit, di ba? So pag pinipigilan mo rin yung anger, ang nangyayari kasi sa katawan is, there is an increase in the level of stress hormones. So yung stress hormone na to is cortisol. And cortisol is normal in the body. We need that to stay alert, to be aware, to keep the blood flowing in our bodies. Pero pag inipon mo yun, sobrang tumaas na yung levels of cortisol, wala na, it will lead to stress. And then stress, if not managed correctly, can lead to anxiety. And anxiety, if not managed correctly, can lead to substance use disorders.
That's very informative. Masyado na, ang galing, okay?
Ang daming nasabi.
Hindi, masyadong nakakatuwa kasi alam ko na ma-appreciate ng mga viewers natin yan. Pero alam ko, Doc, ano pa ang other disorders na nakikita mong common yan? Lalo na sa Gen Zs, nakalalakihan.
Oh, Gen Zs. Well, I'm not really sure if I'm not really sure if there's a particular mental illness for a particular generation. Pero siguro at this time, due to recent events, I think one of the most common ngayon na na-experience ng Gen Z would be anxiety. So it's a multifactorial thing, no? Anxiety. So it comes from socio-cultural yung factors, again yung childhood factors that I mentioned a while ago, and the environment. So because of the pandemic, no, parang very limited yung social interactions natin. But recently naman, we're slowly getting out of the pandemic. Siguro parang mild pandemic na lang siguro. We don't really see that many cases of COVID na, kaya it's pretty easy. It's easier nowadays to go out and bond with your friends. Pero in light of the recent events such as the election and with the political differences, people sharing things online about politics, so madami talagang strong opinions about it. And some people are disappointed kasi hindi nanalo yung bet nila. And some people are taunting others naman kasi parang, buti pa ako nanalo yung bet ko, ikaw nga, iyak ka na. So that's like, it's sparking anxiety sa Gen Z. No, kasi parang, how do I manage this? What's going to happen? What can I do to manage my emotions? So this is one thing that they can do if ever they are feeling strong emotions na parang, anong gagawin ko? Wala na akong control. Hindi ko na alam kung anong mararamdaman ko. So yun yung phrase na naririnig ko lately from the Gen Z. Hindi ko na alam kung anong gagawin ko. Hindi ko alam kung anong nararamdaman ko. So the first thing is to acknowledge the emotion. Pero sabi nga niya, hindi niya alam kung anong nararamdaman niya, di ba? So he or she has to have a conversation with the self. So they have to talk to themselves, no? Write in a journal or whatever, or self-meditate siya. Ask them what is causing this. So ilista nila what they think is causing it. Is it the elections? Is it my candidate not getting the spot? Is it the disagreements I have with people on social media? So once they target the cause, so what they should do is avoid the cause muna. So if social media is the one that's triggering your anxiety, for example, ako din may experiences ako on social media where I was bashed because of a particular video na ginawa ko about vaping, and the vaping community was attacking me, and wala na talaga akong control, hindi ko alam, all of the words, yung mga responses sa videos na yun really hurt. And the thing is, I have no control of what other people will say. I can't tell them to not say those things kasi yun yung nararamdaman nila. Valid din naman na magsabi sila ng ganun. So, for me, the only way to protect my mental health was to avoid social media. So, if social media is the trigger, you just put it aside. Put social media aside. And then, for you to be able to have a good relationship with your mental health, it's important to note that we have 4 hormones na makakatulong sa mental health natin. So we have dopamine, and we have serotonin, endorphins, and we have oxytocin. So oxytocin is known as the love hormone. So ito yung nafe-feel natin whenever we feel down, tapos yung relative natin or friend natin hugs us. So yung that touch that you feel from someone you love, no, triggers the release of oxytocin. So it's important to connect with the people who matter to you. So for example, if you're experiencing disagreements with other people on social media, no, because of the elections, dahil nag-aaway-aaway yung mga colors, okay, move away from it and then talk to your family. Pero sometimes kasi family really doesn't help. That's a sad reality for some of us. Sometimes our family can't really understand what we're going through. So you reach out to a friend, and as long as you know that friend is willing to listen. Kasi may mga friends din tayo who don't know how to listen. So make sure you have a friend that will listen to you. But if you don't have that friend, it's okay to seek professional help. So may mga nagsasabi kasi na, ang mahal kasi ng psychiatrist, sana all may pera daw. Well, there are apps that they can download, like Consulta MD Health Now. That this is not sponsored. Consulta MD or Health Now app, where they can book psychiatric consultations. They cost less than 100, and some of them are even free. So if they really need someone to help them understand their emotions. So if you can't find someone to hug you, then you can find it elsewhere naman. There are professionals who are willing to help you. And then we have endorphins naman. Endorphins are known as the painkiller hormone. So like I said a while ago, di ba, yung stress hormone na cortisol, pag masyadong mataas sa katawan, it increases the level of inflammation in the body, and when your body is inflamed, you feel pain. So high levels of stress, cortisol will make you feel pain. So the way to counter that is through endorphins, which is the painkiller hormone. So how do we get endorphins? Where can we find this? So surprisingly, we can get this from laughter. No, so laughter, if you have a friend na magaling mag-joke, I guess, punta ka sa kanya. But watching comedy movies can actually help trigger the release of endorphins. No, so just look for your favorite funny movie and then just laugh alone, magpakasaya ka dyan, it's okay. Just so you have a good release of endorphins. No? Or if you don't want to do that, you can try moderate to intense physical activity. So like weightlifting, if you're if you're okay with that. Another hormone is dopamine. So this is the reward hormone. Na nati-trigger yung release nito whenever we achieve something. So for example, we have a list of things that we have to do for the day, and if we accomplish them, we have dopamine. Kasi reward, yay, I won something. Or also, celebrating your small wins. So, for example, target mo magka 10,000 views on Facebook, tapos na reach mo yung number of views na yun. So, that celebrating the small wins can help with dopamine release. And also, the number one dopamine releasing action is eating. So, that's why sometimes people tend to overeat when they are going through a rough time in their life, kasi it's through food na nakukuha nila yung dopamine. So it's not a particular food that helps release the dopamine, it's the act of eating that releases the dopamine. Kasi parang pag mumumuya kasi tayo, it mimics the talking. So when we talk kasi about our feelings, it's a good release of dopamine din. Pero some people don't want to talk about their feelings, so they decide to eat. So yung eating motion of the mouth, which mimics talking, kind of tricks the brain into thinking na in-express mo yung feelings mo when really you're not. You're just eating. So that's how dopamine is released. And the last hormone we're going to talk about is serotonin. This is the mood stabilizer. So if you're someone who is not physically active, you will most likely have trouble dealing with your emotions, no? Yung mga strong, intense emotions, you will have trouble dealing with it. But when you start, like simple walking lang every day, exposure to the sun, jogging, yung mga simple aerobic exercises like that can help trigger the release of serotonin so that your mood is stabilized. So those are the things that you can do to somehow manage your anxiety if ever you feel like you're experiencing anxiety. So anxiety is normal naman. No, hindi naman ibig sabihin na pag anxious ako, it doesn't mean na agad-agad na meron kang mental health disorder. Kasi everybody can experience anxiety. Di ba pag may upcoming quiz ka, pag may upcoming deadline ka, if you forgot to do something, you will feel anxious talaga. It's part of how our body works. It only becomes a disorder if it affects your functionality. So for example, parang 1 month ka na anxious. As in dire-diretso, non-stop. And then, hindi mo na kayang kumain, hindi mo na kayang bumangon sa tamang oras, hindi mo na kayang matulog agad, hindi ka na nakakapag-interact with your coworkers, with your family, you decide to isolate yourself. So that's what we mean by functionality. The things that you were able to do with ease before, ngayon hindi mo na kayang gawin because of anxiety. So that's when it becomes an anxiety disorder. So again, anxiety is normal. You can experience that. But when it affects your relationships, your job, and your relationship with yourself, that's when it becomes an anxiety disorder. So kung napapansin mo na medyo wala ka ng control sa kahit ano, parang walang-wala ka na sa life, hindi mo na alam yung gagawin, it's time to seek consult na. It's time to seek consult. Go to a psychiatrist. There's nothing wrong with that. Kasi mental health drives us to success. If you don't have good mental health, then you won't be able to work optimally. So it's important to take care of our mental health.
So Doc, nag-a-agree ka na to be aware sa mga tao na nanonood na importante ang mental health as a physician, kagaya rin ng physical health natin.
Yes, definitely. And my specialization is actually occupational health. And in the workplace, it's important actually for institutions to implement a mental health program. Because if their workers don't have like a good sound mind, maapektuhan yung productivity ng company. So, if for example, BPO workers, so they also have a lot of mental health issues, especially kasi sa mga BPO workers, they have an irregular sleep schedule. So this is one important thing that people should take note of. It's a simple solution to improve your mental health, but a lot of people have trouble doing it. It's maintaining a regular sleep schedule. So, anong oras, Doc? It doesn't really matter as long as it's consistent. So, for example, ikaw yung type na natutulog ng 2 a.m. tapos nagigising ka ng 8 a.m. That's okay. Kung natutulog ka din ng 4 a.m. tapos nagigising ka ng 12 p.m., parang lunch ka na magigising, that's okay as long as you keep it consistent. So, kung pipiliin mong matulog ng 4 a.m., dapat araw-araw kang natutulog ng 4 a.m. So, okay lang yung puyat, or sleeping beyond the night hours. Okay lang yun as long as everyday ganun yung schedule mo. As long as it's at least 6 to 8 hours. What happens kasi pagka hindi regular yung sleep schedule mo, mag-fluctuate din yung hormones mo. And hormones have a way of affecting your mood as well. Now, so we have a hormone kasi that is more active when we are awake, and we have a hormone that is less active when we are asleep. So again, we come back to cortisol. So grabe yung influence talaga ng cortisol sa katawan natin, no? And if you choose na, palit-palit yung sleep schedule mo, yung cortisol mo, hindi niya na alam kung kailan siya tataas, kung kailan siya bababa. So what happens is, maintain na lang siyang mataas. So cortisol needs a resting time din. So cortisol is the one that keeps us active, keeps us alert. Pero hindi naman pwedeng 24/7 na active and alert tayo. Cortisol needs to rest din. So if we don't give cortisol the proper rest time, this will affect everything. So it will affect our mood, in turn will affect the productivity and how we work and deal with our coworkers then. So if your company has not yet started a mental health program, it's okay to demand that. It's actually part of DOLE's requirements then.
Yes, and also, if I may add, sabi nga, kung paano kapag may sumasakit sa katawan mo, nararamdaman mo yung pain, ganun din yun. Halimbawa, mayroon kang iniisip, it's different. It's the same, di ba?
Yes. What Ma'am Frenesi is talking about are psychosomatic symptoms. So the way, for example, with someone experiencing anxiety, sometimes it can manifest as acid reflux disease. So yung parang humahapdi yung tiyan, tapos parang umaakyat yung laman ng sikmura. So anxiety can actually trigger that as well. And again, pag may anxiety kasi mataas yung levels of cortisol, and pag mataas kasi ang levels of cortisol, sumisikip yung ugat sa kahit na anong parte ng katawan. And sometimes, mas malaki yung emphasis ng pagkasikip ng ugat sa utak, kaya sumasakit yung ulo. So, we also experience like neck pain and back pain. So that's part din, Imagine just your mental health can actually affect your body physiologically and physically din.
Mm-hmm. So you heard that from a physician. Yes. Kasi 'di ba, meron tayo talagang stigma, lalo na dito sa Pilipinas, na pag nagpunta ka sa psychiatrist or you ask for professional help, bakit ako pupunta diyan? Meron. Ano kala mo sa akin?
Yeah, that's what's wrong then. Kasi feel nila, because they don't see mental health, it's not real. But we just talked about it kanina, na it can manifest itself physically, yung mental health. And I really hope na we get past the notion na nasisiraan ka ng utak if ever you are experiencing mental health problems, because that's simply not the case. And you can't really blame the person kasi mental health problems also stem from something genetic na mamana siya. So for example, ako at si Ma'am Frenesi, we're experiencing the same problem. For example, may family issue ako, nakapareho sa family issue niya. Pero kasi ako, yung nanay ko, yung lola ko, yung great-grandlola ko, they all suffered, for example lang to, they all suffered, for example, from major depressive disorder. So kumbaga, meron silang depression gene kasi lahat ng generation meron. So sa akin, mapapasa din yung depression gene na yon. And if I am faced with that situation, I will have a difficult time coping up with it emotionally because the way my brain works, the way my DNA works, just cannot process that kind of stressful and negative situation. Pero si Ma'am Frenesi, for example, nakapareho ko naman ng family problem, pero sa family lineage niya, wala namang nade-depress sa kanila, walang may anxiety. It's easier for her to handle the situation. She can manage her emotions on her own without any professional help. So you can't say na nasa isip mo lang yan, na nag-iinarte ka lang. No, because it's not, exactly, because it's not my fault na may namana akong gene that would make me unable to process the negative and stressful situation. So, yun yung kailangan nating maintindihan so that all of us are more understanding and more patient with others. Kasi may mga kaibigan tayo na parang naiirita sila, na
Insensitive.
Yeah, very insensitive. Sabi na, ganyan lang yung problema mo, tapos ganyan ka mag-react. Ako nga eh. People tend to compare agad, pero they don't realize nga na it's not their fault. It's part of their genes. Parang, it's like saying na pag may nag-seizure attack, pag may nag-seizure attack, tapos sasabihan mo siya na, huwag ka nga nagsi-seizure dyan. You can't say na, huwag ka nga nagsi-seizure dyan, nasa utak mo lang yung seizure. Kasi meron siyang genetic abnormality that makes him unable to control his seizure. So the same thing should be applied to mental health disorders. we have no control of the kind of DNA na makukuha natin. Okay? Because namamana talaga yun. Yung kung capable ba tayo i-handle ang stressful situation o hindi.
Thank you so much. Napakaganda nung pagkakapaliwanag na yun ni Doc Kilimanguru.
Thank you.
Yeah. And Doc, would you join me? Sabi mo nga, sa karing mental health advocate. Tutulungan mo ba ako to help our fellow Filipinos to open up na isipin nila na it's okay not to be okay?
Yes, definitely. It's okay not to be okay. Kasi parang meron tayong mentality, I guess, na parang pag may mahirap na sitwasyon, dapat positive lang. Yun yung sinasabi sa atin palagi, di ba? Dapat positive lang. Wag ganyan. Oo, wag ganyan yung mindset mo. Kasi paano ka aahon, di ba? How will you solve this kung hindi ka positive? No, wait, no, wag kasi ganoon. Wag ganoon. Kung fresh pa yung pangyayari, for example, namatayan or na-bankrupt yung business mo, parang, positive lang? Positive lang? Wala na akong pera. There's nothing positive about this. So we have to allow people to grieve. We have to allow them to feel their emotions, no? Parang naiiyak siya, go, umiyak ka dyan. Sige, isigaw mo na lang yan. Ganon. We should encourage them to release their emotions. Kasi hindi naman always na magiging ganun sila. So if we allow them to release it earlier, mas mabilis na mawawala yung feeling na yun. No, yung feeling of struggle para maging positive na sila. So we have to address what is negative. We have to release the negative emotions in order for us to intake what is positive. So hindi pwede yung positive lang. No, ilabas mo muna kung ano ang negative. Kung ano ang negative, kung ano yung masamang nararamdaman mo, sige, ilabas mo lang yan. And then later, pwede na tayo magplano. Pwede na tayo mag-come up with more positive things to address your problem. So there, allow people to feel what they feel. Kasi yun nga, kung i-delay mo pa yun, it will come out in another way.
And lastly, Doc, pasample naman dyan ng jingle mo for us. For the viewers, parang yung kagaya ng ginawa mo sa pag-ire.
So hindi to jingle, actually gagayahin ko lang siya. Wow! Gagayahin ko siya. It's okay not to be okay. Yun yung kanta ni Jessie J. You know that song? Sometimes it's hard to follow your heart. Wow! I forgot it! So anyway, yung message ng song na yun is, whatever it is you're feeling in your heart, don't be afraid to express it the way it is. So don't be afraid na magmura, na sumigaw, na dumabog-dabog. Siyempre in an appropriate place ha. Dapat appropriate yung pag-release mo ng emotions. Okay, yes, there's freedom to express ourselves, pero may social limitations pa rin tayo. Huwag kang umeksena in public. So you find a private place where you can do that, and then i-release mo na lahat doon, where no one can see you, where no one can hear you. Ilabas mo doon, sumigaw ka na, ilabas mo na lahat. It's something that I do whenever I have an argument with a particular loved one. Kasi sa mga relatives natin, for some reason, very intense yung mga arguments natin. And sometimes, there are things na nasasabi natin na mali. So, pag nasa peak ka ng emotions mo, whatever the situation is, you move away, you isolate yourself, you scream, ilabas mo na yun, magmura ka, dabog-dabog everywhere, and after ma-release mo yun, you will feel na parang na-empty yung evil. Yung evil darkness inside of you, mafe-feel mo na na-empty siya, and you're ready to manage the problem in a proper way. Kasi gets ko naman yung parang grace under pressure, ang galing naman niya na kaya niya yon. Pero kung nararamdaman mo na talaga na lalabas na yung demonyo sa loob, you isolate yourself, tapos ilabas mo yung demonyo, and then you can bring back the angel inside.
Yun. Thank you so much for sharing your time and experience, information. We're glad na may natutunan na naman yung mga viewers natin. And of course, follow Dr. Kilimanguru sa Facebook, sa TikTok, and YouTube. Yes. And of course, sabi nga niya sa akin, he'll join me sa aking lakad sa mental health awareness sa Pilipinas.
That's right.
Napasubo.
That's right. For more medical health information, just visit my Facebook page, Dr. Kilimanguru, and my TikTok page, Doc Kilimanguru. Basta yung may blue check mark, char! And again, alam nyo na yan, ligtas ang may alam. Hanggang sa susunod, take care.